I'm Dr. Ziad Ossi, and I founded Precision Health because I wanted to achieve the optimal results for my patients, and I couldn't do that in the traditional medical system.
My name is Patrick Mullen. I'm board certified in family medicine and obesity medicine, and I love to practice data-driven, science-based longevity medicine.
So I'm Sheena Spielberg. I'm board certified in internal medicine and obesity medicine. I came into medicine initially because of my passion for nutrition and fitness, and I loved science. And I soon learned that that's not exactly what medicine was, but I realized that's something that it can be. After 14 years in the traditional medical system, I'm very excited to leave it behind and have an opportunity to join Precision Health so that I can spend the time I need to for my patients, work for my patients, and help them optimize their health and prevent the chronic diseases that end up leading us to shorten our health spans and disability at ages that are too young.
Our facility is purpose-built for comprehensive high-end clinical care. From rapid in-house lab testing to IV therapy, aesthetics, and a functional assessment gym, everything you need to understand and optimize your health is here under one roof.
You know, what got me interested in this format of care was really kind of thinking around the last third of my life and saying, how can I live my best life? And having a partner that can guide you through that process. So when something goes wrong or goes sideways, it's not what you expect, to have that partner that you can rely on to ask, you know, what should I do? When this opportunity came up to work with concierge medicine, it became a no-brainer for us to decide to go forward with that. I like the personalized care and responsiveness that you get with Precision Health.
We have a lot of patients in our practice that we can consider success stories. One of my favorite demographics is the 50 or 60-year-old guy that says, hey, you know, I'm doing fine. And he comes in and 6 months later tells me, I haven't felt like this in years. He didn't know that he felt that his energy was low, that his sexual drive wasn't where it should be. And after optimizing him metabolically as well as nutrition and hormones, you have some of these guys feeling like they're 30 again.
I love to do research on holistic methods. I like to do little experiments on myself with my health, you know, to see like, oh, would this help? So it intrigued me, and it was something that I was tired of. I think you reach a certain age where things just sort of pop up, like menopause, joint pain, strange ailments that you didn't have before. I wasn't someone that was ever really sick. My doctor's appointments were always very check the box. I was in and out. And now that I am getting older, I've noticed some things. My body's changing. And so this was a good time for me to pivot into something like this because, oh, you're just getting older. So, you know, these aches and pains, it's normal. And I wanted a more holistic approach.
We'll see you soon.